Hi Galveston Dieters, it's Dr. Mary Claire Haver. I am the creator and founder of the Galveston Diet. I'm also a board certified OB-GYN who works very part-time because I spend most of my time managing the Galveston Diet and creating new, I keep researching and learning to bring more information to you guys. So I'm coming to you today to give more information about a post I did recently about tests that you should ask your physician for those of you who are getting your Well Woman's coming up. What kind of 5 groups of tests should you ask for in order to maximize your Well Woman exam in midlife? And I'm talking 35 plus ish. So if you don't, if you want to pay attention to this, if you are not a woman who's 35 or older who goes for their annual exam, this may not be the video for you. So, but for the rest of you, hang tight. Let me pull up my notes. So I put a lot of thought into, now that I know what I know, if I was going to the doctor, what would I want to ask for lab tests to be drawn? First of all, during your Well Woman exam, your doctor should, do a physical, take your history down, listen to you, maybe order some blood tests. If you need a pap smear, get that drawn, do your pelvic exam, all of that. And I remember, for my patients, most of them just trusted me, and I'd say, okay, let's do some blood work. Fine, they go get their blood work. They never maybe asked. I probably told them, but I don't remember going into detail what was drawn. And then someone from my staff would call and say your tests are normal or not normal or whatever. But if they were normal, they just followed up for the next year. And so what I realize now that I've done so much extra research on my own, in nutrition, in metabolism, in the interplay between aging and hormones and inflammation, that there are probably a few tests out there that we could do better. And some people come to me and say, well, this is your job. You're a doctor. You should automatically order this test. Well, some of them, you need a diagnosis code in order for it to be covered by insurance. Some of them really only need to be drawn if you're having fatigue, which so many of us are. If you're having hair loss, if you're having skin changes, if you're having bleeding gums, if you're having anxiety, depression, that will qualify you to have some of these lab tests drawn. So here's my advice. First, before your Well Woman exam, before you even make the appointment, you need to call and you want to make the first morning appointment. You want the fresh doctor who just got there. You want the doctor who's relaxed, she's had her coffee, she's excited to start her day. You don't want the doctor at the end of the day. I'm sorry, it is what it is. Who's frazzled, who's been on the phone all day, rushing back and forth between patients, putting out fires, maybe trying to deliver a baby. By the end of the day, you get a little frazzled and everybody's in a hurry to get home. So just in my personal experience, and I'm not trying to throw other practitioners under the bus, everybody's fresh first thing in the morning. Try to get that first morning appointment. The other reason for doing that is you can go in fasting, okay? You can go in fasting because a lot of these lab tests have to be done fasting. And if you're not fasting, it's going to delay you getting the test. And so I like one-stop shopping. I'm sorry, I'm getting warm. When you go into the physician, you get all your exam, you get your blood work, you get your mammogram, everything all in one day. Boom, done. That does take some homework ahead of time. So try to get the first morning appointment at 8 a.m. the minute the shop opens. You're first. And even that makes you wait a little bit longer. It's worth it, unless you're having some emergent thing that needs to be taken care of. The other is write stuff down. Call your mom, call your grandma, call your aunt, your sisters, get everybody's history. Make sure and your dad and everybody else. Make sure you know your family history, especially for chronic diseases, and write it down. Okay, having a family history of certain diseases is going to qualify you for certain lab tests. Okay, fatigue with a family history of hypothyroidism will qualify you for most insurances in the full thyroid panel. Okay, not just the basic, which is the TSH, and I'll get into that here in a minute. The second thing is to write down your symptoms: fatigue, nausea, weight gain, weight loss, hair changes, nail changes, skin changes, vomiting, diarrhea, anything out of the ordinary that is affecting your life, especially on a chronic basis. Are your periods changing? Are you having cramps? Anything on GYN, everything you can think of. Write it down, because those become diagnosis codes that can help insurance pay for the test. Now, I'm going to give you a list of tests that I would recommend for just about any woman, especially those with fatigue and some of the more common symptoms. You can always call the insurance company yourself and find out what's covered, and you can educate your physician on that. And remember, your physician is not perfect, okay? She's been to school, she's been through a ton of training, she probably knows a lot of what she's doing, but she doesn't know you. She might be rushed. There may be a baby in labor. She may have a backup call. She may have to go tell the next patient she has cancer. Be your own advocate, okay? Another piece of advice, take someone with you, because you get forgetful. Take someone with you who's going to be there to make sure you say the things you need to say and make sure you get the answers you need to hear, okay? It's always great to take an advocate. Now, I know with COVID, it's hard. Maybe they don't let anyone come in the room with you, and there's nothing we can do about that if that's the situation. But if it's allowed, I really advise that you bring someone with you. If you can't bring someone with you, have them on speed dial. Dial them into the conversation. They can ask the questions with you and be there. That's what we're doing during COVID these days is, have your advocate there via Face, Skype, Zoom call, whatever works. Have them there present at least via your smartphone. Okay, so you've made your first morning appointment. You've gotten your family history and written it all down. You've gotten your own personal history and written it all down already neat as possible. Doctor has to read this, and you're going to take it to your doctor, okay? Any medications that you've been taking, any supplements, anything over the counter, write it all down together, okay? And that's what you're going to hand to your doctor, okay? So now, you're ready to go. You show up. Okay, so the first group of tests are what I call the standard tests. These tests are for 35 and over, routinely done without you even asking on every visit. One is the complete blood count, the CBC. The other is the comprehensive metabolic profile, the CMP. CBC, CMP. You usually don't even have to ask for those. They're great screening tests for most. Again, some insurances are picky. Make sure you're your own advocate. You can get, so CBC is what measures your white blood cells, your red blood cells, your platelets. That's a great indicator of anemia, screening test for anemia. It can also give you a clue if you have certain blood cancers. It can also tell you if you have a condition like thrombocytopenia where you have low platelets or polycythemia where you have high platelets. It also can give you an indicator of how your immune system is functioning. So very, very important test, one of the most common things we draw, the CBC. Second test in that portion is the complete metabolic panel. This bad boy has 14 different levels that we're checking. 14. It's measuring your electrolytes. It gives you some function of your metabolism. It's measuring your kidney function. It's measuring some of your basic liver function. It's a very, very, very important test, okay? Calcium, potassium, those are in there, important nutrients we need to make sure we're getting enough of in our diet. They have so many functions in the body. You've seen my videos on individual nutrients and what deficiencies can do to your body. So the complete metabolic panel, they may try to draw a basic metabolic panel, which only has 7 to 10 depending on the lab of those levels. Fight for the comprehensive, okay? Second test is a diabetes screen, okay? Over 35 women should be screened for diabetes. Some places may try to draw just a fasting glucose level. That is not the best test we have available to screen for diabetes. Certainly if your fasting is above 200 or something, you're diabetic. Yep, you got it. But there is something called a hemoglobin A1C, okay? That test gives you an idea of what your blood sugars have been doing over the past six weeks. So you take, it's basically how many sugar chains have attached themselves around a red blood cell. And so the more chains you have, the higher the percentage of A1C, the more likely it is that you're diabetic. It can also tell you if you're pre-diabetic, and maybe some lifestyle and nutrition changes can go a long way into keeping you from ever developing diabetes. So that's the hemoglobin A1C, okay? The second test. Also, elevated A1Cs are linked to cancer risk and Alzheimer's disease risk. So, number 3, and I see the question down below, thyroid panel. Typically, and this is what I was taught to do, we do a TSH, which is a thyroid stimulating hormone. You can miss Hashimoto's disease with a normal TSH. So it is worth your while, especially if you have signs of hypothyroidism or hyperthyroidism. So your weight gain, weight loss, rapid pulse, slow pulse, fatigue, sleeplessness, restlessness. I mean, there's tons and tons of stuff out there to get the full thyroid panel. And that's going to be the TSH plus the free T4, which is the actual thyroid hormone level, a free T3, which is kind of the backup thyroid hormone, a reverse T3, and there's 2 thyroid antibodies, the TPO, thyroid peroxidase antibody, and the antithyroid globulin. That is the full thyroid panel, and that is what I recommend to make sure you're not missing some of these diseases. Now remember, 1 in 10 women will have hypothyroidism. It is so common. 10% of us have hypothyroidism. 60% of them don't know it. They are not diagnosed yet. So it is so important that you get this test done, because you can be, in early stages and having some vague symptoms but can't quite put the finger on it. And guess what? You're hypothyroid. It runs in the family. If you have a family history, you should qualify for the panel. So that is one that you're going to want to fight for. Third round is nutritional deficiencies, okay? I never checked vitamin D when I was in clinical practice. I just kind of was becoming I hear about it, or I'd get labs from another doctor and see a vitamin D was checked, and I'd be like, why'd they do that? Since I've gone through all the nutritional learning and education, oh my God, 42% of us are deficient. It's linked to so many disease states. It is a coenzyme that is active in so many functions and parts of our body. So you have got to get that vitamin D checked. It's so easy to supplement. It's so easy to get through nutrition. It's so fixable. And so many people feel so much better just with vitamin D supplementation. Another you might want to consider is a zinc and a magnesium level. Those are commonly low in people, and zinc is linked to if you have poor wound healing, if you have, I've got my notes over here, I want to make sure I don't miss anything, unexplained weight loss, wounds that won't heal, a lack of alertness, and decreased sense of smell and taste. Now, no COVID. Everything's COVID, but it could be a zinc deficiency. Magnesium deficiency is linked to poor sleep, nerve problems, mood disorders, fatigue, muscle cramping, headache, brittle hair, and nails. Again, any of those symptoms, ask your doctor for this test. The fourth group of tests is the Anemia Panel, okay? Remember, we all got a CBC at number 1. That can tell us if we're anemic, but there's more information than in the anemic panel than you realize. So that's going to be your iron level, your ferritin, which is your iron storage hormone, your folate, and your vitamin B12. So your iron can be low and your ferritin can be low. They kind of go together with normal hemoglobin. And you can have symptoms from low ferritin and low iron before your blood count realizes that it's anemic. Restless leg syndrome, RLS, is related to low iron levels, okay? When your iron levels are low long enough, the anemia will follow, microcytic anemia. But you can pick this up early and supplement and eat iron-rich foods and treat and head this off at the pass before you ever become anemic. So important. I think this is just such an important test. There's also folate and B12. So folate and B12 are linked to, or usually from malabsorption or decreased, you're not getting enough in your diet, especially if you're vegetarian or vegan. B12 is found in a lot of animal products, and it's a little bit harder to find for vegetarians, especially vegans. So it's important that if you're vegetarian or vegan, you get your B12 level checked and you supplement if you need it, okay? And then the fifth thing, the last one, is chronic inflammation testing. Chronic inflammation testing. This one gets a little controversial. Other physicians are like, I'm not testing that. I'm like, okay, you do you, but now that I do so much functional medicine through nutrition, I want to know what these levels are if the patients have these complaints, chronic inflammation, increased risk of chronic disease, fatigue, swelling, bloating, pain, all of it. These tests are non-specific, meaning they go up in all inflammation. So the erythrocyte, the high sensitivity CRP, C-reactive protein, the serum protein electrophoresis, and or erythrocyte sedimentation rate, and the erythrocyte sedimentation rate and the plasma viscosity. Sorry, I just see a typo in my notes. So the type A in me has to fix it. Because we're going to post this on our blog today. So I need to fix that typo. So this is telling us that you have high inflammation levels, but it's not telling you exactly what's inflamed or why you're inflamed, what thing is causing it. But here's why I like it. because you can start instituting these nutritional and lifestyle changes for 6 months, Galveston diet for 6 months, and then get those levels checked again and see that they come down. It's a hugely motivating factor, knowing that you have changed the course of your life and decrease your risk for chronic disease simply through diet and lifestyle, simply through nutritional changes and some lifestyle changes, which to me is so powerful for you as a patient, to have that, to have that strength, so that feedback for yourself that it's working. And besides the scale and the weight and the clothes and I'm healthier because my inflammation levels are down. So this will be a blog on www.galvestondiet.com. If we don't get it posted tonight, it will definitely be up by tomorrow. I need to tell my IT person we have a very small typo to fix. Actually, I'm going to share this with her right now so that we can fix it. So, but this is the stuff I like to do. And so you being your own health advocate, and I'll go over these again. You being your own health advocate, you fighting for what you feel is right, you shopping around and finding the right doctor, you writing these things down, bringing an advocate with you, taking the time to make sure that you're getting the best health care you can is only going to work in your favor. So thanks everyone for listening. I'm going to go through these tests again real quick. So number 1 is what I call the standard tests. They're probably going to be drawn whether you ask for them or not, and that's going to be the CBC, the complete blood count, CBC, and the CMP, the comprehensive metabolic test. CBC tests for anemia, it's a screening test for some blood cancers. It's also a screening test for some immune disorders. The second, immunity issues, not immune disorders, immunity issues. Number 2, the comprehensive metabolic panel talks about your metabolism, your kidney function, your liver function. Okay, it also looks at your electrolytes, your sodium, your potassium, and your calcium levels. Super important. And then number 2 is the diabetes screen. I recommend the hemoglobin A1C. Absolutely insist on that. And then 3, a thyroid panel, not just a TSH. A thyroid panel is going to include a TSH, a free T4, a free T3, a reverse T3, and a TPO antibody, as well as an anti-thyroglobulin antibody test. Okay? Y'all can watch this on the repeat and write those down. So nutritional deficiencies, absolutely everyone should have a vitamin D check because 42% of us are deficient, okay? And possibly a zinc and magnesium if you have certain symptoms. The Anemia Panel, which is going to include iron, ferritin, okay, your folate and your B12, okay, and then finally the chronic inflammation test, the high sensitivity C-reactive protein, the erythrocyte sedimentation rate, and the plasma viscosity can go a long way as markers of inflammation for you to track and follow to see that your nutritional and lifestyle changes are working and that you are healthier. All right, everybody, let me look back. Can you tell us the difference between folate and methylfolate? Not here, thyroid cancer. Okay, I'll answer these after and type them out, some of the stuff I have to look up. All right, everybody, I have to get back to work. Take care.